Welcome everyone to Blooming in Your Backyard, Harnessing Opioid Settlement Funds for Local Impact. We are so excited for you to be here today. And just so you know, we will be recording today's session and we'll be sending it out shortly after our time together today. To get things started, we're going to go over the goals for today's webinar. Today, you will gain an understanding of the opioid settlement funds, learn more about the 50% of the funds administered to local jurisdictions, hear about prevention efforts that target early adversity, and hear from local perspectives on how to use those funds. To kick off our time together, I'd love for you all to hear greetings from Barry Allen, one of our grant makers with the Bloom Kentucky initiative. Welcome, Barry.
Thank you, Hannah, and good afternoon. Welcome, and thank you for your participation. If ever there were a cause serious enough to demand all of our energy and spirit, it is the urgent battle against the opioid crisis that plagues our children, youth, and families. And if there ever were an opportune time to bring solutions to this battle, now is that time. Although no amount of money is sufficient to cover the cost of lives lost and destroyed from this plague, we must capitalize on the $900 million in settlement dollars, blood money, if you please, that the Commonwealth is expected to receive over the next 16 years, one half of which will be decided by the Kentucky Opioid Abatement Advisory Commission and the other half by local municipalities. What a challenge we face, but what a responsibility we must accept and fulfill. And to fulfill this challenging responsibility, those of us in leadership must be fully informed and equipped to access and to utilize these settlement dollars to win the battle in our communities. To that end, the Bloom Kentucky Coalition of Grant Makers from around the state are most grateful to the Kentucky Association of Counties and its Opioid Settlement Advisor, Lauren Carr, for providing assistance in navigating best practices and the reporting guidelines for the effective use of these funds. Bloom Kentucky is a coalition of 32 grant makers from around the Commonwealth who've come together for the first time in history in a united statewide public policy advocacy initiative to reduce the impact of adverse childhood experiences and to give Kentucky children and families reason for hope, which in turn will result in a healthier, more prosperous future for all Kentuckians. We are educating, encouraging, and enabling policymakers as well as the public to plead the case, to enact policy changes, and to provide funding that will address the multi-generational challenges of ACEs, and to move upstream to prevent these experiences from occurring in the first place.
Our community.
With a high correlation between ACEs and addiction, we are offering our assistance and collective wisdom to the Kentucky Opioid Abatement Commission and the Kentucky Association of Counties in the effective distribution of these settlement dollars. Lauren, thank you for making yourself available to assist us in harnessing the opioid settlement funds for impact in our local communities and for living out your calling with selfless humility and conviction. Lauren?
Thank you, Barry, for that introduction. I am so thrilled to be in this position, but before I begin, I need to share my story and a little bit about me. I grew up in a broken home filled with addiction and childhood trauma, and when my older brother Justin started to use substances, I didn't understand why. I couldn't understand why. I've often found myself in a whirlwind of emotions as I watched my brother struggle with his battle against opioid use disorder. Despite our shared past, I began to realize that each person's journey through pain and trauma is deeply personal and complex. Justin's words often echoed in my mind. I'm just trying not to feel sick. I just want help. You don't understand. This was in 2011 at a time where access to treatment, healthcare, and recovery services are not where they are today. My brother died of a fentanyl overdose, and it was the first time that I had even heard of that drug. It was then that I began to understand that his addiction was not a choice, but rather a coping mechanism to numb the generational pain that he was given.
I just needed to log on. I did. I got some.
As I navigated through my own emotions of confusion, grief, and helplessness, I vowed to do whatever I could to help those experienced with substance use disorder. At the end of the day, dead people don't recover. And when a fatal overdose occurs, that person doesn't get a chance to heal, rebuild their lives, or mend broken relationships, or find peace with themselves. It became clear to me that understanding, empathy, and support were all essential in addressing addiction. I was able to turn my pain into my purpose and started a career in working in prevention at Graves County ASAP. We had a drug-free communities grant, and while I was working on that, I saw how we could engage and encourage youth in prevention activities. Last year, I began working on the opioid abatement funding for our county, and as you all know, it's a learning experience. Last year I worked with national and state partners in this field, and the opportunity arose to provide technical assistance to local governments, counties, on how to make best use of these funds and stay within the settlement guidelines. I joined the team at KACo in January, and I'm thrilled to be in this position and eager to provide that support. Today, we will be talking about the local funding. So kind of like Barry said, there is two pots of money. There is the pot that's at the commission, and that is governed by grants. It's actually a really hard grant process, but it is a grant process, and then 50% goes to cities and counties. So what I'm going to be speaking about is the 50% that is at the city and county level, specifically because I represent counties. I'm going to talk about county level work. So these decision makers, I want you all to understand who the decision makers are in their communities. And the decision makers of the local funds on a county level is your fiscal court. And your fiscal court is made up of your judge executive and either magistrates and commissioners. And in a city, it's going to be your mayor and your city council. It is important that the decision makers of these local funds might not be subject matter experts in the field of opioid remediation or even prevention. Most local governments are used to other funding sources, such as grants or funding from the state, and this money is specifically from litigation and has guidelines specifically for opioid remediation. 85% of the funds that the local government gets has to be spent on forward opioid remediation. And so it is crucial to recognize that investing in youth prevention programs is not just a short-term solution. It's the investment that is the long-term health and prosperity of our communities. And by prioritizing prevention, we can break the cycle of addiction, empower youth to make informed choices, and create a brighter future to what's to come. So what do I recommend you all to share your story? Get to know your elected officials, attend a city council meeting or attend a fiscal court meeting and ask where the funds are going to. Now, as a county, they have different options to utilize these funding. Say, for example, if they were going to utilize it in a jail, if they have a jail facility and they wanted to have peer support or offer medicated assisted treatment or anything like that, that is an opportunity. But some counties don't even have jails, or also in Kentucky, we're not ready for that yet. And so there are different opportunities for you all to share your story and really give that proposal to your local leaders so they can know what opportunities are out there. And it's important. I'm going to kind of talk about supplanting and supplementing. So it is with these funds, we are not allowed to supplant, meaning that we can't take one funding source and use the opioid abatement funding for that. What it is designed to do, and because it is millions of dollars, but spread out over 16 years and 120 counties, and then half of that in litigation, there are dollars that can be spent, but we really need to make the most impact with these funds. And so really looking at low impact but low cost but high impact opportunities. And so it is to supplement programming that is already going on, or to expand those unmet needs. So whether your coalition or your community is wanting to navigate something, and I'll talk about this a little later, but as you all know, kind of working in grants, there are very particular things that you can and cannot spend these funds on, where on the local opioid abatement funds, they are really to help these programs so they can meet those unmet needs. And so it's really important to know your decision makers, understand how the process works. And even if you have the best proposal, sometimes it is up to the local leaders. So I just want to say it is important to share your case and share why prevention efforts is needed. When we started Graves County ASAP, our youth council, one of our first youth council meetings is that we presented at the city council in fiscal court, just to let them know that the coalition had started and these youth were being actively involved. And so getting involved in that really helps build those relationships. Also, prevention is listed in the KRS statute and the National Settlement Agreement as allowable uses of funds. And then there is also a subsection of the statute. There's about 29 different things that it can be funded towards. So understand that statute. There is a link to that. So just understand how these funds can be spent. And there's an innovative way. You can be innovative in opening up a new pilot program or something, or expanding something you haven't done. They say an ounce of prevention is worth a pound of cure. And before we hear from local perspectives, I'm going to hand it over to Dr. Shannon Moody to talk to us a little bit about the relationship between adversity and substance use, Kentucky's data on adverse childhood experiences, and how we can prevent adversity as a tool to preventing substance use.
Thank you so much, Lauren. I want to say that we are very lucky as a state to have you in the position that you're in. KYA has had the opportunity to know and get to know Lauren even before coming into the position at KACo. And I just know that with your personal experience and with your heart and your passion, we are going to be in such a good position to ensure that these dollars are used in a meaningful way that prevents use in the future. And just thank you so much for your vulnerability and sharing your own personal experience. It's really impactful. So Lauren had talked about the importance of making sure your local leaders know what the connection is between what you're hoping to see happen, the project that you're talking about, the proposal that you're submitting, and the connection to substance use and preventing opioid use disorder especially. And we want to talk a little bit about how adverse childhood experiences connect to substance use disorder as well as opioid use disorder, in addition to not just individual experiences within a child's life, but then the environments that they are also in. So we know that there is a very clear link between childhood trauma and problematic or disordered opioid use. We also know that just because you have an adverse childhood experience or multiple adverse experiences, it doesn't mean that you are going to have poor health outcomes in the future. There is a lot that we can do during childhood, during adolescence and early adulthood, and well into adulthood that can prevent the linkage between adversity and environments to later opioid use or disordered substance use. So we know that adverse childhood experiences like maternal depression, divorce, mental illness, incarceration of parents, substance abuse of parents, physical and emotional neglect, those can lead to poor health outcomes in the future, including the use and misuse of substances. We also know that poverty, discrimination, violence, poor housing, and lack of economic opportunity or social mobility can also contribute to the lack of coping mechanisms, healthy coping mechanisms that we build in childhood. So it's really important to consider the connection between adversity, whether it's in the community or within childhood, when we're talking about the opportunities to prevent opioid use down the road. On the next slide, we have identified and pulled a lot of research related to the connection and relationship between adverse childhood experiences and substance use. We have more than this compiled, and what I will say is that we can send this out as a follow-up with the information as well as the sources if you're interested in digging into any of this research. But just to really demonstrate the connection between childhood adversity and substance use, we know that abuse, neglect, and then those household dysfunctions that we had talked about, like parental incarceration, untreated mental health issues, can increase the likelihood of early initiation of illicit drug use by 2 to 4 times. So we know that if we're experiencing a lot of those things in childhood, if it's not treated and mitigated, or if there are no prevention or intervention opportunities, we are more likely to see those young people use illicit substances. We know that teens who have experienced physical or sexual abuse are 3 times more likely to report past or current substance use than those compared without a history of trauma. We also know that there is a link between depression and adolescent opioid use. And a study that I found incredibly interesting, and I think needs to continue to be lifted up when we talk about the consideration of Kentucky especially, is that 4% of adolescents overall report misusing pain and medication and opioids. Adolescents living in rural settings, which most of Kentucky is, are 35% more likely to misuse prescription opioids compared to youth in larger urban areas. And in addition to that, individuals who report taking prescription opioids during high school have a 33% greater risk of misusing opioids by the age of 23. So we need to be really cognizant of our young people, especially our young people in rural settings who are being prescribed pain medication, who are maybe utilizing pain medication that's not prescribed from a friend or family member. Being aware of that risk is really important, and creating opportunities for prevention of that misuse is really important as those young people move into adulthood. And then another item to highlight is that every increase of one trauma was associated with a 12 to 23% increase in odds of early initiation of opioid use across all of the 7 opioid use behaviors. There's research that tells us what those 7 opioid use behaviors are, with trauma being a factor in a child's life. With every different type of trauma experience, there's a big increase in the odds of initiation. So we know that there is a connection, but we also know that just because you experience trauma in childhood does not mean that you are going to turn to substances if you have an opportunity to address those issues. On the next slide, we'll talk about the prevalence of ACEs and adverse childhood experiences in Kentucky. For those of you, most folks at this point, especially who are working in the space, are familiar with childhood adversity and early and adverse childhood experiences. This stems from a study from 1995 based in California that 2 physicians were actually looking at the connection between childhood. They were looking at the connection between obesity and incidence in childhood. So just kind of generally incidence in childhood, and then later discovered that people who had were experiencing obesity in adulthood were more likely to have these traumas, and then started digging in further to figure out what else it was causing as far as poor health outcomes. So in Kentucky, we are in the top 10 for parent incarceration. We are number 14 in the nation for child maltreatment, abuse, and neglect specifically. We have high rates of domestic violence and kids witnessing domestic violence. and then high rates of mental health issues and substance use issues that go untreated. We continue to see an increase in access to treatment, but there's still a lot of shame and stigma around accessing treatments, especially in our rural areas. So things to consider in the Kentucky context, and why it's really important to address these things to ensure that we're not seeing later opioid use when kids reach adulthood. And on the next slide, the Centers for Disease Control and Prevention have put together a framework for preventing adverse childhood experiences. And these 6 strategies are things that we can see happen in all of our communities across Kentucky, and especially, in places where we have committed individuals who are interested in seeing us addressing adverse childhood experiences or preventing it to begin with. So strengthening economic supports for families is a major strategy for preventing adverse childhood experiences. As we talked about, we know that in unstable housing, living in neighborhoods with high rates of poverty, those can create adverse environments for children. Promoting social norms that protect against violence and adversity, including making sure that children understand the importance of mediating or mitigating violence and having other means to address their challenges, whether it's interpersonal challenges or challenges at home. Ensuring a strong start for children, a lot of that comes down to and is connected to access to quality childcare and access to quality early childhood education. Enhancing skills to help parents and youth handle stress, manage emotions, and tackle everyday challenges. A lot of that is skill building within our families, within our homes, and also within the settings that children are in, like out-of-school time programs. Connecting youth to caring adults and activities. Again, we see this in out-of-school time programs, as well as within school, as well as within things like the HANDS program. And then intervening to lessen immediate and long-term harms, creating opportunities for young people to cope with their difficult and challenging and really big emotions, whether that's through programming, whether that's through access to mental health services, making sure that young people have access to be able to address their emotions and are not turning to poor coping mechanisms in adolescence or adulthood. And then on the next slide, we have a brief video. So if folks are familiar with the HOPE project and the 4 building blocks of HOPE, this is a really great explainer of what that is. And and Hannah's gonna start that video for us. Hannah, I'm not hearing the sound on it.
Let me try this again. Thanks everyone for your patience.
Like a tree, we carry our past with us. The Healthy Outcomes from Positive Experiences framework is based on research that shows that positive childhood experiences help create healthy, thriving adults, even when there's been childhood trauma. In the past few decades, there has been a lot of research about the long-term health effects of childhood trauma. But HOPE provides a path to resilience and adult health through positive childhood experiences. The HOPE team has categorized these experiences into the 4 building blocks of HOPE. These building blocks include relationships within the family and with other children and adults that feel safe and supportive. Safe, stable, equitable environments to live, learn, and play. Social and civic engagement to develop a sense of mattering and belonging, and opportunities for emotional growth. HOPE works to shift the focus for anyone who works with children personally or professionally from one that is negative or deficit-based by only identifying risks and problems to one that identifies, celebrates, and promotes access to these critically important positive childhood experiences. HOPE promotes a culture of thriving and resilience.
So what you're going to hear next from Lauren is the emphasis around ensuring that what we are putting forth is rooted in research and rooted in evidence. And this HOPE initiative is born out of Tufts University. And if you are interested in learning more, we can drop a link in to that work. But next, I'm going to turn it back over to Lauren, who is going to dig further into some interventions and opportunities.
Thank you, Shannon. It is important when allocating these funds to make sure that you use an evidence-based approaches or promising practices. And we have the opportunity, we have this one-time opportunity to make a generational change, but there is research that shows what works and what doesn't work. And so making sure that you have ongoing prevention activities, scare tactics is something that the evidence shows that does not work. So it's really important to invest these funds in evidence-based practices. Now, sometimes when we are innovating or trying something new, there might not be the research to show of it. So promising practices have those outcomes that might not be researched yet, but are valuable and to guide and measure your outcomes. So it's just really important. I know that sometimes you want to think that we can do a one-time assembly or bring a speaker in or anything like that, but it's really important to make sure that you are using evidence-based approaches and also how these funds can make an impact, make that generational impact. So whether that is bringing a speaker in, but making sure that there is wraparound programming in there. So those youth are not just getting a one-time prevention message. It's really important to have that wraparound program. So there is a tool. Johns Hopkins University is over 50 organizations came up with a guide for opioid abatement spending from the nation. And they have 5 principles of how to utilize these funds. And the third one is invest in youth prevention. Opioid overdoses among adolescents have steadily increased over the past decade, and approximately half of people with substance use disorders start substances before the age of 14. Prevention strategies that aim at building resilience among teens can significantly impact their resistance to substance use. Fostering coping skills, promoting positive peer relationships, and enhancing parent-child communication all play a vital role in empowering teens to make informed and healthy decisions. Also, investing in youth prevention is a very favorable return on investment and an estimated $18 for every $1 spent. There is a new tool that is on the landing page of Johns Hopkins University, and it can help you identify what indicators and what metrics you want to measure as far as for your proposals, and also give you some very innovative ideas on how to utilize these opioid abatement funds. Now, it's going to go over all of the 5 principles, so there will be some about treatment and the criminal legal system and different things like that, but there is prevention in there, and you can, it's like an online tool where you can click on, you want to do prevention in a community, and here are some examples, and then the metrics of how are you going to measure that, because it is important, and I'll mention it here, but it is important, even if a fiscal court gives out the funds to a local health department, a local community coalition, anything, it is important to have that data reportable to the fiscal court, because at the end of the day, the fiscal court is responsible for these funding. So it's important not only to build those relationships, but also have your research and have, like, for example, if you had an after school program, but you wanted to extend it and you wanted to provide more services, you reached 20 at-risk youth, and you were able to meet with them once a month. Having those metrics and having those things is what will make it easier or will make it for local governments to grant out the funds. So if they know where the funds are going and how the funds are being spent, because they are responsible for the funding. So even if they give it out to a third party, at the end of the day, they are responsible for it. And I think that opioid abatement is a new realm for local government. And so I don't want to say everybody's afraid of it, but they are afraid because they don't know how to spend it. And so one of the things that I can provide is that assistance to help counties navigate towards what are the best practices and different things like that. And so I've been around for a couple months, and I'm going to show a couple just different local examples on prevention. And then we can, so I've only been in this realm for a couple months, and so we are trying to, one of the first things that we're trying to do, because even at the state level, people are asking how are the local funds being spent, and there is nobody knows unless that there's the opioid tracker and different things like that, if there's news articles, but their reporting requirements are just that they spent the money in accordance to the statute. And so one of the things that we are doing at KACo, and we're going to be rolling out within the next week, I hope, is a baseline survey to the county officials to see how, if they've spent any funds, where they've spent it at, and what more information that they would like. So we are putting it in there if it's prevention, if it's criminal legal system, if it is access to care, treatment, wraparound services. And then that way, I think that it's really good. You'll have my contact information, but it'll be really good to connect. So if I have a community that reaches out that they want to focus in prevention, and we have prevention groups in this county or community, we can connect those partnerships. And sometimes it just takes that. And so two local funds that I just want to talk about in action. I'm going to talk about Clark County, and then I'm going to turn it over to Courtney to talk about Graves County. So Clark County, they are working towards their recovery community. And one of the things that they are working on is a stigma reduction campaign. The listening tour is free, but they want to get people to there. And as you know, funding, sometimes when we work in grants, funding can be very splicy as far as like, you can't spend it on this or this or this. And these local abatement dollars can meet those unmet needs. So they are supposed to supplement programming that's already going. So how could you make something better? Whether it is a mentoring program and you want to add more youth to that, or it is a town hall and you know that in order for you to get individuals to that town hall, it might be good to have some incentives as far as food or childcare for people to attend. You know, showing those unmet needs, that is really showing how these funds can make a lasting impact, where it's a very low cost but a higher return on investment. And counties are eager to spend the money, but they might not know what. I mentioned the survey, and it's important to understand the statute regulations and then build your case. I'm going to turn it over to Courtney and talk about and I say we because I'm from Graves County, but we were able to share our story with our fiscal court and city council and share the importance. And she's going to talk about some of the prevention aspects that we've utilized with those funding. And I'm going to turn it over to Courtney.
Okay, thank you, Lauren. Some of the youth prevention programs that we have been doing, we just got done wrapping up our life skills program. We did that the month of March, but we had 4 different series of life skills classes for students to come to, and they covered financial literacy, cooking, personal safety, how to change a tire, mental health, relationship building, all the different life skills that they need to have. And that is an evidence-based practice, even though it might not directly relate back to substance use that is equipping those students with the skills they need to be a productive adult. And then just a few more of the events and initiatives that our students do. They do a mental health awareness campaign in the month of February, which ties back to substance use because a lot of the time that is a co-occurring disease. Project Teen we do during the summer, which is where we provide a safe place for students to go during the summer, whether that be a movie night or a bowling night, or just providing that atmosphere for teens to have somewhere to go and have friends that are doing the same thing that they are doing, and just to show that, hey, you're not the only one that's living above the influence and living a substance-free life. We did go to KACo in February, and we were one of the presenters. So we got to present in a room full of 400 plus people. We did take a student. She presented as well with us. Lauren, what else would you like me to, you know just as much as me or more.
It is to one of the things that Graves County is looking at is sending SRO officers and youth to the mid-year leadership forum. So not only providing that substance, that is something that is not in the budget, but it is something that can supplement youth leadership. And so that is just an idea. Even if you have a small program, I recommend sharing your story. I think that it's easier to, and you can't supplant these funds. So you can't take these funding and pay for somebody's salary like directly if they were already being paid for before. But if you can have oversight and then you can expand anything, that is really how these funds are for, because we're talking millions of dollars, but when it comes down to it, over 16 years, 120 counties, some counties are only getting $30,000 and $40,000. And then you minus litigation, and then they have some money now, but it's because they got 5 years at one time. And so it's really thinking about how you can make those low cost investments, but really expand your programming. And as we move forward, I just want to reiterate that every dollar spent on prevention today saves multiple dollars in future healthcare and social cost. Community leaders such as yourself can advocate on policies that prioritize prevention and allocate resources where they are needed the most in our schools, community, and support networks of young people and families. Together, we can turn the tide of opioid crisis and build a healthier, safer, more resilient society. Thank you guys for your attention. I am here. Oh, yes, I forgot about this. Sorry, Hannah. These are just some examples. I think a lot of people wanted some examples of tangible things that could be done. And so even raising awareness about ACE, I know that they have bounce training where you could have that into your school system. That might not be something that your school can afford, but having that proposal, expanding on sources of strength or any after school programming, mentorships, really building those relationships with those youth and empowering youth. So ongoing education inside and outside the schools. I've heard of communities looking into grieving family programming. So whether it is individuals that their grandparents are raising their grandparents are raising their grandchildren, or their parents are incarcerated, providing support for those individuals, whether that is resources, things like that. And there's social workers in schools. There are, I don't want to say there is endless possibilities, but there's endless possibilities with these funds when you think about the opportunity that to really make a difference, and not that treatment that doesn't need to be it doesn't need to be funded, because treatment, we need to get people in those beds, but you have to think about the funding that's out there versus the funding that's not out there. And so sometimes you can look at your local needs and work with your partnerships. And, you might have treatment availability, but what's that barrier from getting people to treatment? And I know we're talking about prevention, and I don't want to go over too many things, but I really see that these funds as the unmet needs for your community. So whether that is needing to bring on somebody to teach sources of strength in your middle school, or even providing an incentive for a community night or anything like that, I think that these funds would make an impact in your community with the work that's already being done. But also, if you're looking to start a new project or a new proposal, this is a really good opportunity to share your story and get that funding.
All right. Well, we have just a little bit of time, so I thought I would stop sharing and give a moment for us to pause. And if you all had any questions at this time for Lauren or Shannon or Barry, now would be a time that you could ask. And I will open the floor for any questions or comments that you may have. And then once I allow a little bit of time, we'll talk through some final things and wrap up.
Is there a way for us to know how much money our local county received?
Muted. So on our website, we have just created a opioid resource library. And in there, you kind of see there's breakdowns of, I want to say, the first 3 J&Js, or the first 3 distributor settlements. And it's important to know that there's ongoing funding, so there's ongoing litigation. There is litigation. I don't want to say that the money is coming, but there is the pharmacy litigation. There's Kroger. There's pending litigation. But if you go to the KACo website, you can look under your county, and it can see. I believe that it's on there where you can see. It might even have the towns too. I'm going to double check that. I'd say that that's a very good question. But also that is something that I don't want to say we don't have access to, but we are trying to get more information about that. Yeah. Okay. So if you click, it's a very long list, but the National Settlement Opiate, it has Kentucky, and it breaks down the cities and counties. And so that would be the allocation amount. And some, for like the first 3, I want to say that they prepaid years. And so some counties received a bigger portion, but that's because it's it's a lump sum at one time.
There's a question in the chat. What is a recovery ready community, and how does this money relate to them?
Recovery Ready Communities is a certification from the state, and it kind of is an overview of what ecosystem you have in your community as far as prevention, treatment, recovery. And it makes communities work together to see what your unmet needs are. And it can really, you can apply to the state to get the certification to be a recovery ready community, but that kind of just means that your ecosystem or the recovery capital in your community supports people in recovery, or supports prevention efforts, harm reduction, different things like that. And so there's more information on recovery ready communities. It is a really good starting point to look at if you don't know what your needs are in your community, because you can really kind of get a baseline to see what programs are out there and what programs are not, and then how to address those unmet needs.
There was another question. It said, do you know of any projects aimed at addressing chronic absenteeism in school?
That is not my area of expertise. So I've never worked in a school environment. So I know that it is I cannot answer that question. Somebody else might have a better answer for that question, but I'm not sure if there's any projects, except I know personally it's really important. Each person, each teacher has that opportunity, and this is the Bloom opportunity to plant that seed. And so when you plant that seed with a youth, you can watch it grow. And so I'm sure that there might be a program that is specifically for chronic absenteeism, but that is not my area of expertise.
There is an evidence-based program for truancy. I'm not exactly sure what the name of it is, but I know that we've been trying to implement that here in Christian County.
It's the parent engagement meeting or parent engagement model. There are programs kind of mixed across the state. It's typically in collaboration with the Frisky, the Family Resource Youth Service Center, and school and courts, or sometimes the Community Collaboration for Children program. It will also, I'm not aware of any of that being funded by the opioid settlement dollars. I don't know if that's, the Department for Community-Based Services has been piloting that in a couple of different regions. And I think the longest standing one has been in Jefferson County through the Community Collaboration for Children in 7 counties.
I saw the next question about projects providing wraparound services for families. I would just, it is very important. Every local community has different local needs. So seeing what services are out there and how you could, there might be an organization that is providing, I'm going to use the example of Celebrate Recovery, or providing NA or Al-Anon or any of those kind of meetings. And you could expand that to where it still provides services for individuals affected by substance use disorder, but help that wraparound services. I'm not necessarily vast on projects. I think that this opportunity gives local community members the opportunity to be innovative, but also with that tie to substance use disorder and preventing substance use disorder, opioid use disorder, or the effects of it. And so kind of like Barry said, that this is blood money. At the end of the day, a lot of individuals died to be where we are today. And we have seen the ripple effect of this. And so it is crucial to work together in your community to figure out what those needs are. And then if you have something that is working good, whether it's a recovery community center or it's an after school program or it's a church, whatever that's working good, how you can add to that to help those wraparound services. And that's my best answer for that question, if anybody else.
I'm capturing some notes, so we'll continue to dig in. And if I find any follow-up information, I'll be sure to include that in the follow-up email. Great questions. Anyone else? And I appreciate those that are sharing some of the resources in the chat. Thank you all. Great space to learn. All right. Well, if you all continue to think of things, feel free to drop those in the chat as well as follow up via email. Well, I will get the PowerPoint going again. Hopefully you'll be able to see it, and we'll wrap things up. So here at Bloom Kentucky, we believe in equipping you all with the tools to make changes in your community. And so we have some resources that we'd like to share with you all. We have an opioid settlement planning toolkit, and this toolkit is a great outline for the planning process. It talks about considerations around a planning team, who should be on that team, how to start the conversation, tips for writing and submitting the proposal. And while this toolkit is more geared towards the grant process within the commissioned funds, many of the tools and resources within the toolkit are applicable to the local process. And then we also have the opioid abatement flow chart. And I think this is a great visual for understanding the opioid settlement funds. And I encourage you to take these resources with you and share them within your spaces and within your community so that folks can better understand these funds and so that these funds can be used to really make an impact. My colleague will be dropping links to those in the chat, and I'll be sure to include those in the follow-up. Well, we have come to the end of our time together today. I want to just thank you all for spending your lunch, your afternoon with us. You could have been somewhere else, but you were here, so we appreciate you. I wanted to let you know as well that there are some great opportunities to stay connected with Bloom. We have some listening and learning sessions coming up, and we also are looking to co-host them in various regions across the state. So if you're interested in learning more about ACEs, adverse childhood experiences, PACEs, positive childhood experiences, or even more about the opioid abatement work, we would love to come and partner with you and hear about not only the challenges that are happening in your community and how we can address those through policy, but we'd love to hear about the strengths and some of the amazing things that are happening within your community. So feel free to reach out to us. We have all kinds of great resources and data that can help you throughout your different programs and processes. We'd also love your feedback. We have growth mindset around here at KACo, and we'd love to grow and improve. And so this survey would be very helpful to us as we think about future opportunities for you all and ways that we can improve. And I will send a follow-up email with all these resources and this PowerPoint as well as the recording to you all so you all can have it and you all can share it with one another. The survey will collect some of the feedback as well as questions that you may have. So feel free to complete that at your convenience. As an exit ticket, feel free to complete the survey, but otherwise, thank you for spending your afternoon with us. And together, we are going to work and to cultivate a commonwealth where all children and families can flourish. Thank you for being here today, and thank you for what you do in your communities to make an impact. We appreciate you, and if you ever need anything from us, feel free to reach out. Thank you all.